We say this story happened a long time ago, back when the great Turtle Island was brand new. And back at this time, there was a village of Haudenosaunee people. And one day, as the sun was starting to go down, an old man came walking into the village. You are so kind to a stranger, an old man who has come to your village, traveling from far away. Why is it that you are so good to me? And the old woman said, "Oh, grandfather, the Creator taught us long ago, gave us instructions, said anytime old people come to our house, we should be very good to them. And especially travelers that come and visit our village, we should be kind, give them food and shelter in our village. I would like to give you a gift. I would like to teach you about something out in the forest. I want you to go out and walk along the path that leads towards the river. And where the path splits, you will see a tree that's growing." And he described the tree to her. He described what the leaves looked like as they grew. And he described to her those roots, what they look like, how they would grow. And he gave them a name. He said, "I want you to remember this. Remember those roots. They will take away the sickness." Each day he would send the Bear Clan mother out into the forest, and he would tell her right where to find a certain plant or root or bark or leaf, and each day she would gather it, bring it back, and he would turn it into good medicine.
The new great circle of life, from our stories, they understand that, all the interactions we had with all these other life forms, whether they were trees or birds or fish, they could see the ecosystems, and we developed narratives and stories and a whole life, of interconnectedness. We now know, because of current technology, we can look even into greater depth into our human biology, and we understand we have the same herds or the same flocks or the same pods of animals that exist inside of our belly, that exist inside of our lungs, and they do these really wonderful things for them if we take care of them.
Just pick up any, yeah. Try passing it to the other hand and then setting it back down. Good job. Oh, I have a career change on their hands. Who knows?
Translational research aims to determine the best way to harmonize scientific discoveries with communities. An important part of this process includes creating culturally sensitive methods that are benefit to Indigenous nations.
So we do them quarterly, and Roswell happens to be our partner today, our co-host.
Community-based participatory research can help reduce health disparities.
Thanks, Rodney, Michael. Mayor, always good to see you. I'm just delighted to be here.
By creating strong bonds between researchers and the public, understanding what communities need, want, and experience will help design specialized cancer programs, treatments, and policies to benefit Indigenous nations. Cancer is the leading cause of mortality among Indigenous peoples. Working with researchers to administer frequent and accessible screening can greatly reduce the risk of cancer progression and increase the likelihood of overcoming the disease.
All the downstream genes that are associated with the EGFR, skin regeneration,
because I know, one of my family members, I don't know, I was very young when he passed, but I remember him.
When you're looking at Native Americans, in terms of cancer, what I think, in the absence of really understanding what's driving those increased cancer rates, is we have to really increase our diligence on screening, on awareness, on involvement in trials where we begin to look at what those exposures or those inherited conditions might be. And that's where getting involved in clinical research is so important, because even with smaller numbers, it increases our ability to understand how to prevent it and how to treat it better if we get more, say, Native Americans involved in research.
It's extremely beautiful, and it's just going to be here for such a long period of time that it's just, I love it. I love it. It's just vibrant. At the American Indian Cancer Foundation, as a national organization, we're looking to support changing the cancer outcomes across all 567 tribal nations. So while we're based here in Minneapolis, we have to figure out ways to reach across Indian country. Lung cancer is a significant problem because it accounts for more cancer deaths than the next 3 top cancers combined. In American Indian Alaska Native communities, that is even a bigger problem because our smoking rates are so high, and we know that smoking is the biggest risk factor for lung cancer.
Health disparities are health differences that are closely linked with social, economic, or environmental differences in communities or populations, and often adversely affect groups of people who have systematically experienced greater obstacles to good health based on characteristics historically linked to discrimination or exclusion. Health disparities in Indian country also vary by nation, region, and gender, and correspond to similar trends in mortality rates.
I've heard from many tribal leaders that cancer is a major concern for their communities. I see tribal leaders all the time, and they talk about just having come back from another funeral in their community. It's very heartbreaking to hear about some of the high rates of cancer in Native communities, and hear the tribal leaders speak about wanting more solutions and wanting more research and more treatments to help people live longer and to get the care that they need. The one thing I've heard from tribal leaders is they want more prevention efforts. They want to learn how they can help their community prevent cancer so that they don't have to lose their members and that they don't have to see the disease burden that they see. Well, we're very interested in translational research. There's so many research studies going on, clinical trials that have great results for the general population. But there needs to be translational research to help take those scientific findings and see if they can apply positively to different communities. And that's so important for American Indians and Alaska Natives.
I am standing on the edge of one.
In terms of checking yourself over and pre-screening for cancer is vitally important today because it is so pervasive. With cancer, it's how early you catch it, and how early you catch it really depends on how well you can manage the event.
Sure, there's a lot of historical trauma that we have experienced, our parents have experienced, and their parents. So now is the time where we step forward and we make change. We ask our community to get involved, to be a community again. Our children, they're looking for a place to belong. So now is the time, more than ever, because of the transformation on our earth, for us to come together, rebuild our communities, come back together again, sit around the table and talk to one another about how we can heal.
This won't be the end.